Hey everyone, this is Dr. Andrew Heck, president of the Pennsylvania Chiropractic Association. So what we're going to do today is go over how to talk with your legislator about House 1106. After Lobby Day, we've gained a lot of experience in some of the nuances of what legislators are looking for as far as the talking points are concerned. So we're going to basically pretend like I'm in a meeting with a legislator just so you can see what that looks like and make it a little easier for when you have communications on your own, talking with the legislators either in your home district or via a Microsoft Teams call. Imagine we're in a Zoom or on a Microsoft Teams call. So it's a good thing to do to just start introducing yourself. My name is Dr. Andrew Heck. We're here today to talk about House Bill 1106. So the reason that we need to have this bill in the first place is because there was a court case back in 2018 where a chiropractor was sued by an insurance company. And through that court case, the judge interpreted our scope of practice and we lost the ability to delegate exercise. So the purpose of this bill is to create the Certified Chiropractic Assistant program, which would allow us to now restore our ability to delegate therapeutic exercise. So the basic premise of what this program involves, we're using the national standard provided by the Federation of Chiropractic Licensing Boards, which is one of our national organizations that they're working hand in hand with the various state associations across the country, and they assist them with procedurally, and they also provide national guidelines. So we're using this national guideline program for this certification program. Now, through the education component, there will be an examination that the Certified Chiropractic Assistant will have to perform through the NBCE, which is the National Board of Chiropractic Examiners. So that is the examination program that all of our board exams are done through, so they'll be done through that same organization. The idea then is we're able to delegate therapeutic exercise once the chiropractic assistant is certified. Sometimes you'll get some questions about what is the involvement, a procedural standpoint, what is this chiropractic assistant going to be doing? So to answer that question, the chiropractic assistant, all they're doing is just helping the patient perform the exercises. They're not going to be doing any clinical duties as far as determining which exercises are being performed or prescribing the reps or sets or anything. That's all done by the chiropractor. And the other question that they get is, why would the judge make that determination with the court case? The way that you answer that is to say, when they interpreted the scope of practice, they had thought that therapeutic exercise required the education and training of a chiropractor. So just stepping back a little bit, the Certified Chiropractic Assistant is going to be watching over the exercises with the patient, which will allow the doctor to be able to treat other patients and perform examinations, more of the complicated procedures and therapies that they're involved in. Some other things that are important to highlight is the state of where we are as a chiropractic industry. So we've also are trying to attract more chiropractors, more professionals to the state. And one way that we were trying to identify what the state of chiropractic is through partnering with West Virginia University. So we did a study with them to determine how many chiropractors were going into each state, how many chiropractors were leaving each state or retiring. And what we found was that Pennsylvania was in 48th place in replacement rate of chiropractors. And there's only one county, that's Cumberland County, in the center of the state outside of Harrisburg, that is at the 50% replacement rate. So that means that chiropractors, which are mainstream conservative care healthcare professionals, are leaving the state and are choosing to practice elsewhere when they're graduating, because the way that the laws and regulations in Pennsylvania with how they're currently set up are not attractive for new graduates. So we want to encourage legislation that is going to attract providers to this state. House Bill 1106 fits the bill there. That provides some context. If you have somebody that is, when you're researching their background, if you see that they're a small business owner, in their past history before they became a legislator, it's also really important to highlight that most chiropractic offices are small businesses, and they understand that well. So anything that can occur from increasing administrative duties, how that affects your practices. Well, that affects small businesses. And thinking of it through that lens is helpful. So the chiropractic industry in Pennsylvania is primarily made up of small businesses. We are in one hospital system that's in the Lehigh Valley network at St. Luke's. There are chiropractic programs there, and then we are in the VA system as well. But other than that, the chiropractic industry is composed of all small businesses. So overnight, after the judge interpreted our scope of practice, we had to lay off employees that were performing therapeutic exercise for our patients. And a lot of times, because chiropractors don't have a lot of time to perform a code that has a timed constraint associated with it, as you guys know, therapeutic exercise, you have to be with the patient for 8 to 22 minutes in order to bill 1 unit. So average that about 15 minutes, you're only able to see 4 patients an hour. Imagine your practice if you can only see 4 patients an hour. It's hard to financially sustain that. Being able to delegate this exercise is extremely crucial so that we can reintroduce this therapy in combination with the adjustment. As we know, the research says that is a combo that is very effective. But because of that time constraint, this is a therapy that is often abandoned as a result of being unable to delegate this service. So that just gives you some talking points as far as, how you need to adapt to the legislator, identify, are they Republican or Democrat? Are they going to be more likely to be looking at it from an access to care issue than push that the inability for you to perform this procedure in a timely and efficient manner is preventing patients from having access to conservative healthcare options? That's going to be something that's really important for somebody that is pushing for access to care to hear. If they're more in the small business owner mindset, share how that affects the way that your business operates. And you can bring personal stories when you're doing this in a one-on-one conversation with your legislator as well for how it's personally affected your office. But hopefully that helps you guys. Now that we have finished up with Lobby Day, we are very excited about the state of our bill and the progress that we've made so far, but we want to continue to ask our legislators to contact Chairman Burns and ask them why this isn't a bill that has yet been on the agenda for the committee. So we're going to push the bill at the committee level, put on the agenda, and we also are asking for co-sponsorship or general support from the members as well. Thank you all for continuing to help us. We want to make Pennsylvania a great state to practice, and House Bill 1106 is going to do just that. Thank you.
We are the PCA.